Hello and welcome to the Pace Hospital podcast. Today we are shedding light on one of the most challenging and often misunderstood cancer, that is pancreatic cancer. Pancreatic cancer is known for its silent progression and late detection, making awareness and timely diagnosis absolutely critical. Many patients and families have questions about early sign, risk factor, available treatment option, survival outcome, and what supportive care looks like during and after treatment. Joining us today, Dr. Suresh Kumar is a highly experienced surgical gastroenterologist and laparoscopic surgeon with his extensive expertise in abdominal surgeries and gastrointestinal oncology. Dr. Suresh will explain the early warning signs of pancreatic cancer, discuss the available surgical options, and answer the most frequently asked questions related to pancreatic cancer. Dr. Suresh Kumar, thank you for joining us at Pace Hospital's High-Tech City. Let's start by understanding what is pancreatic cancer.
Hi everyone, I'm Dr. Suresh Sepuri, consultant surgical gastroenterologist and GI oncosurgeon at Pace Hospital High-Tech City. Today we'll be discussing about an important topic that we have been seeing significant increase in incidence in our day-to-day life, that is pancreatic cancer. So you should understand what is pancreas. Pancreas is an important organ. So it is important not just for its function but also for its location. It is present at a critical point in our body. So any cancer that occurs within this pancreas is called as pancreatic cancer. It is in close approximation, that is most of the organs, vital organs, are nearby to the pancreas. Hence any cancers that occurs in the pancreatic cancer are of very important clinical significance.
So doctor, what are the risk factors for pancreatic cancer?
Now we'll discuss about the risk factors for pancreatic cancer. There are certain important risk factors for pancreatic cancer we all should know. First and foremost is the smoking. Second is the obesity. Third is age. Fourth is diabetes status. These are the four very important risk factors. Apart from these four risk factors, there are certain other set of risk factors that are also there but are not as important as these four. We'll know a little bit in detail about the risk factors for pancreatic cancer. First is the smoking. So most of the cancers, especially of the GI system, are directly or indirectly related to smoking. The risk of pancreatic cancer doubles in the patients who smoke when compared to the patients who doesn't smoke. And also the pathogenesis for pancreatic cancer in these patients who smoke is multifold. That is, most of the times it is the carcinogens that are there in the tobacco that causes direct impact on the pancreatic tissue that may lead to pancreatic cancer. It can cause direct DNA damage to the pancreas, and it also causes inflammation within the pancreas and surrounding the pancreas that can lead to chronic pancreatitis changes, which can ultimately lead to pancreatic cancer. And also we should know, most of the times we see patients who come to us telling that I have stopped smoking a year ago, a couple of years ago, but still I am at risk of developing cancer such as pancreatic cancer related to smoking. Yes, it takes not less than 15 to 20 years after quitting smoking to decrease the risk associated with pancreatic cancer subject to smoking. So we should all understand that smoking is very important risk factors and stay away from smoking in decreasing the risk of these cancers. Second on the list is obesity. Recently we have seen a significant increase in the incidence, that is number of patients with overweight or obesity. It is associated with various GI malignancies just like smoking. We also seen that 20 to 25% increase in the risk of pancreatic cancer in patients who are obese when compared to patients who are non-obese. So just like smoking, obesity is a pro-inflammatory state. Patients who are obese or overweight have these pro-inflammatory factors that cause inflammation within the vicinity of the pancreas that may ultimately lead to pancreatic cancer. Apart from smoking and obesity, next in the list is diabetes. We all know that diabetes is due to less production of insulin or increased insulin resistance. It is the increased insulin resistance that can cause this inflammatory response within the vicinity of the pancreas, which may ultimately lead to pancreatic cancer. So age. Just like any other cancers, Pancreatic cancer is most commonly seen in elderly age group, that is people who have crossed 50 or 60 years age. Apart from these four major risk factors, there are certain factors such as chronic pancreatitis. That is, chronic pancreatitis is a disease in which the pancreas is seen fibrosed. That is, there is fibrosis changes within the pancreas. It is called as chronic pancreatitis. These chronic pancreatitis patients are also at risk of developing pancreatic cancer. The risk is 15 to 20% more when compared to general population. 5 to 10% of these pancreatic cancers will have significant family history. There are certain syndromes which run in families that are at risk, increased risk of developing pancreatic cancers.
Dr. Suresh Kumar, how common is pancreatic cancer in India?
If we talk about the incidence of pancreatic cancer in Indian setup, undoubtedly we see a rising trend. That is, number of patients detected with pancreatic cancers have gone significantly over the past few years. Most of the times it is due to the change in lifestyle, due to all this westernization, increased adoption of smoking, junk food, obesity, diabetes status in general population. All this has led to increased incidence of cancer in India. In the recent studies, we have seen that the incidence of pancreatic cancers in the tune of 2 to 3 for every 1 lakh population in India. Although it is significantly less when compared to the Western counterpart, we are definitely seeing an increased trend in this Indian population.
Can you explain what are the symptoms of pancreatic cancer?
As you all know, pancreatic cancer is most commonly called as a silent killer because most of the symptoms associated with pancreatic cancer are subtle. Most of these symptoms will be treated as some dyspeptic symptoms, that is some random gastric problems. So it's highly likely that these symptoms are missed initially. So most of the patients will be diagnosed in the late stages when the disease is in the advanced stage. So what are the symptoms? We should be very cautious about these symptoms. What are the early symptoms of pancreatic cancers? There are certain early symptoms which should raise suspicion of pancreatic cancer. Say we have a patient who is elderly man with a history of diabetes, who smokes a lot, comes to us with sudden unexplained weight loss or sudden jaundice or sudden loss of appetite. All this will raise suspicion of underlying pancreatic cancer. So the early symptoms will be like some vague dyspeptic symptoms, vague abdomen pain, or jaundice. The jaundice, yellowish discoloration of eyes or yellowish urine, this is called as jaundice, or sudden weight loss. All of a sudden people will notice that his weight or her weight has come down without any which is most of the times unintentional. We call it as unexplained weight loss. And people who are erstwhile diabetic will notice that their diabetic control has gone out of way. That is usually previously that whatever the tablets they are used to take previously might not be working as usual. So this is loss of diabetes control in especially diabetics. This loss of control, all this will direct us towards probable underlying pancreatic cancer. So these are the early symptoms of pancreatic cancer which should never be neglected.
So doctor, how is pancreatic cancer diagnosed?
In a suspicious patient, as we discussed earlier, who is at high likely of underlying pancreatic cancer, will undergo a series of tests to diagnose or confirm underlying pancreatic cancer. The initial test would be like ultrasound, simple ultrasound of the abdomen. In ultrasound of the abdomen, we'll see if the patient is jaundice, we'll see if there is any mass lesion within the pancreas, or if there are any nodes, or if there are any changes secondary to obstruction of the biliary system or pancreatic duct. All this will lead to diagnosis of pancreatic cancer or increase the suspicion of pancreatic cancer. If still that pancreatic cancer is not diagnosed, most of the times it is not confirmed on ultrasound. If the element of suspicion raises after ultrasound scan, we will subject this patient to CT scan or PET CT scans. Due to increased availability of PET CT, we routinely advise PET CT scan in these patients. In PET CT scan, we'll give contrast into the abdomen, into the body through IV, and we study the pancreas as an organ and surrounding tissues like lymph nodes, bile ducts, stomach, and major blood vessels. If there is any suspicious mass lesion, after giving contrast, we will study the characteristic of this tumor and confirm upon it diagnosis. So apart from the diagnosis, PET-CT also helps in staging of the pancreatic cancer. We will discuss subsequently what are the stages of pancreatic cancer. So PET-CT not just confirms the cancer, it also stages the patient the stage of cancer. Most of the times patient will be insisting on biopsy. Biopsy is nothing but taking some tissue from the body and subjecting it to a microscopic examination. It is to confirm the diagnosis like any other cancers, but it is not mandatory in pancreatic cancer, because in highly suspicious patients, if the tumor characteristics are confirmatory of pancreatic cancer, we usually don't subject the patient for biopsy until and unless it is required. There are certain circumstances in which the pancreatic tumor biopsy is required to confirm the diagnosis, especially in elderly patients otherwise subjected for an chemotherapy, that is chemotherapy given before surgery, or who are subjected for a major surgery which requires major blood vessel resection and reconstruction. In these patients we will ask for a biopsy. Otherwise we usually don't require biopsy in this patient for diagnosis.
Dr. Suresh Kumar, what are the stages of pancreatic cancer?
So stages of pancreatic cancer, like any other cancer in the body, pancreatic cancer is also staged. It is stage based on PET-CT scan or CT scan of the abdomen. So there are 4 stages of pancreatic cancer. Stage 1 is early tumor. That is, the tumor should ideally will be less than 4 centimeters and there is no distant or spread to the surrounding organs. This is stage 4. That is tumor less than 4 centimeters without any spread. Stage 2, tumor will either be more than 4 centimeters or spread to the surrounding organs. That is, it could either be lymph nodes or organ nearby to the pancreas. Stage 3 is a localized advanced cancer. It is spread to a number of organs within the vicinity of the pancreas or to the major blood vessels that are in close proximity to the pancreas. Stage 4 is the disease in which it has spread to the distant organs, that is the liver or omentum or peritoneum or any lungs, bone. Presence of all these metastases will be a stage 4 cancer. So like any other cancer, the prognosis of these patients will be dependent on the stage of the pancreatic cancer.
Could you explain what does metastasis means in pancreatic cancer?
We often see the term metastasis in CT scan report of the patient. So what is metastasis? As we discussed, whenever the tumor, when there is a pancreatic cancer which has spread to distant organ, that is like most of the times it will be like liver or lung or bone, this spread is called as metastasis. It denotes that the underlying cancer is stage 4 cancer.
So doctor, why is pancreatic cancer often detected at an advanced stage?
As we discussed earlier, most of the symptoms related to pancreatic cancer are subtle symptoms. We relate most of these symptoms to some random gastritis symptoms, some random food poisoning symptoms, and thinking so, we usually don't take advice of a physician or surgeon or any medical help in the presence of these subtle symptoms. And by the time we have any prominent symptoms, the disease will be like advanced. So it is the underlying subtle symptoms that makes the diagnosis of pancreatic cancer difficult in the early stage.
Dr. Suresh Kumar, what are the treatment options for pancreatic cancer?
So most of the times it is the surgery that is curative in pancreatic cancer, but unfortunately most of the patients who at the time of diagnosis are not treatable with surgery. Only 15 to 20% can be treated by surgery at the time of diagnosis. So most patients will end up requiring some form of neoadjuvant, that is any of the treatment given before surgery, some form of neoadjuvant therapy like chemotherapy or radiation. So there are various treatment options in this pancreatic cancer. First and foremost is the surgery, which has curative intent. Second is the chemotherapy. Third is the radiation, and fourth is any form of palliative treatment.
Can you explain when is surgery an option for pancreatic cancer?
So coming to the surgery in pancreatic cancer, pancreas is divided into various parts. Within the body is divided into various parts: head, body or neck, and the tail region. The tumor, depending on the site of origin of the tumor, there are various surgical options in these patients. Most of the times it is the head and neck of the pancreas that is most commonly the site of primary. So the main problem with the tumors arising from the pancreatic head is the close vicinity of certain important structures. So because head of the pancreas is sandwiched by very vital structures, that is blood vessels like portal vein, hepatic arteries and common hepatic artery and the anterior aspects, and bile ducts. That is bile duct, that is a channel which connects the liver to the intestine, that is also in close proximity to the pancreas. Presence of these vital structures make the treatment, surgical treatment in these patients tricky. But the only option, as I said, the only curative option in these patients with pancreatic head cancers is surgical removal of head of pancreas along with the surrounding vital structures, which is termed as Whipple's.
So, doctor, what is the Whipple procedure and when it is done?
As we all are aware, Whipple's is a very major surgery. Traditionally, it used to have mortality in the rate of 15 to 20%, but with advanced understanding and improved post-operative care, the mortality, that is the death risk after the surgery in these patients, have significantly come down to less than 2% in high volume centers. But what exactly is Whipple's? That is, Whipple's is surgery. Whipple's is one form of surgery which is done in patients with pancreatic head cancers. In Whipple's, there are certain number of organs which are removed, which includes pancreatic head, part of the stomach, duodenum, part of the small bowel, gallbladder, and part of the bile duct. After removing these structures which are in close proximity to the tumor, all these channels has to be reconstructed. There are certain reconstruction methods also. The main Achilles heel in these patients is a pancreaticojejunostomy. As I said, a part of the pancreas, that is pancreatic head, is removed in pancreatic cancer tumors. Then the remaining part of the pancreas, that is the body and the tail, are again joined with the part of intestine. That is, intestine is, in this case, is jejunum. This is called as pancreaticojejunostomy. Apart from this pancreaticojejunostomy, the stomach is rejoined with the part of small bowel. It is called as gastrojejunostomy, and the bile duct, that is the channel which connects the liver to the intestine, is also rejoined with the small bowel jejunum. It is called as hepaticojejunostomy. So all these are the reconstructions that has to be done after removal of the pancreatic tumor, because traditionally this surgery used to take some 10 to 12 hours in the good olden days, but with improved surgical instruments and increased expertise, it is in these recent days it is completed in 5 to 6 hours. And the usual recovery time is 2 to 3 days, and it can come down further when it is done through minimally invasive techniques, that is like adopting robotic or laparoscopic.
Dr. Suresh Kumar, what is distal pancreatectomy?
So whenever this pancreatic cancer occurs in the body and tail region, we don't do pancreatic head resection, that is Whipple's. What we do is distal pancreatectomy. And distal pancreatectomy is removal of the part of the pancreas distal, that is lateral to the pancreatic neck, that is body and tail of the pancreas. This is called as distal pancreatectomy. It is totally different from Whipple's surgery. So choosing the option between Whipple's and distal pancreatectomy is dependent on the site of the tumor.
Can early stages of pancreatic cancer be cured?
Yes, there is very good chance that when the patient presents to us in the very early stage, that is less than 2 centimeter tumor with no evidence of distant spread, then these patients are at a good chance of cure. As I said earlier, most of the times by the time the patient comes to us, it will be advanced. It is due to the underlying subtle symptoms associated with pancreatic cancer. The major problem lies in detecting these patients with early tumor. Now it is very important to screen the high risk patients for any underlying pancreatic cancer and not to take easy these subtle symptoms which can tell about the underlying pancreatic cancer.
So doctor, can pancreatic cancer be completely prevented?
So as we discussed earlier, there are certain risk factors associated with pancreatic cancer like smoking, obesity, diabetes and all these. So whenever these risk factors are there, it is important to curtail all these factors which increase the risk of pancreatic cancer. There is no way we completely zero the incidence of pancreatic cancer, but we can decrease the incidence of pancreatic cancers by changing the lifestyle.
Is pancreatic cancer hereditary?
Yes, Although most of the pancreatic cancer, that is 85 to 90% of the pancreatic cancers are sporadic, that is, there is no underlying family history or no underlying genetic effects that can cause pancreatic cancers. 5 to 10% of patients will be having this family history of pancreatic cancers, which can lead to increased risk of cancer when compared to general population. These syndromes usually run in families. So whenever we suspect these genetic syndromes, that is, in patients who have more than 2 family members which are affected with the same pancreatic cancer or associated cancers, that is the ovarian cancers, we subject these patients for genetic testing to risk the offsprings.
So, Dr. Suresh Kumar, does smoking increases the risk of pancreatic cancer?
Definitely, smoking is one very important risk factor for pancreatic cancer. We should all be aware that smoking doubles the risk of pancreatic cancer in the general population. So, 25% of the patients with pancreatic cancers are directly related to smoking. That is, 1 in every 4 patients with pancreatic cancers are directly related to smoking. Smoking has various number of carcinogens within it that induce this process of inflammation and can cause directly DNA damage within this pancreatic tissue. Because pancreatic tissue is very sensitive to this carcinogen, these patients are at very high risk of developing pancreatic cancer when compared to general population.
So, doctor, there is a link between diabetes and pancreatic cancer.
Yes, there is an established link between diabetes and pancreatic cancer. In diabetes, especially in patients with chronic pancreatitis, there is a constant inflammation going within this pancreas that can lead to pancreatic cancer eventually. And also in patients with otherwise type 2 diabetes, there is normal diabetic patients that we see day in day out. In these patients there is something called as insulin resistance. Insulin resistance can also cause these inflammatory changes and eventually pancreatic cancers.
Can obesity a critical risk factor for pancreatic cancer?
Yes, obesity or overweight is an important risk factor for various cancers, and pancreatic cancer is one among them. Obesity is a state of pro-inflammatory, that is, there is pro-inflammatory factors within the bloodstream that can cause inflammatory changes in various tissues. When these changes occur in the pancreatic tissue, they can cause pancreatitis, which can eventually lead to pancreatic cancer. Apart from this, there is increased leptin levels in these patients with obesity that can directly cause pancreatic cancers.
Dr. Suresh Kumar, does untreated pancreatic cancer lead to jaundice?
Yes, for that matter, jaundice can either be an early symptom of pancreatic cancer or it can be a late or advanced symptom of pancreatic cancer. In patients who present with jaundice are supposed to be most of the times will be in advanced stage, and when these patients in whom surgery can't be conducted, the ultimate solution in these patients with jaundice will be palliative stenting, which can relieve the patient of jaundice but not of the disease.
So, doctor, one final question. What is the survival rate of pancreatic cancer?
So as discussed earlier, survival in these patients is dependent on stage of the cancer. So most of the times when detected in early stage, that is stage 1 pancreatic cancer, there is good chance we can give cure to the patient. And but literature wise, it is 85% of the times these patients will go on to live more than 5 years from the day of diagnosis. But unfortunately, most of the patients will be diagnosed in advanced stage. Hence, the prognosis also will be poor when compared to the early stage pancreatic cancer. It will be in the tune of 15 to 20%. When we are talking about survival, it is the 5-year survival. That is the number of patients who make up to 5 years from the date of diagnosis. It will be in the tune of 15 to 20%. But when the patients present to us with metastasis, that is presence of distant disease, the prognosis will be dismally poor. These patients will live on an average for 3 to 4 months from the date of diagnosis.
Dr. Suresh Kumar, thank you for sharing crucial information regarding the pancreatic cancer to our listeners. We hope this discussion helped patient and caregiver to gain a clearer understanding of pancreatic cancer, its warning signs, treatment option, and what to expect during care journey. If you or your loved one has symptoms, risk factor, or concern related to pancreatic health, please consult a surgical gastroenterologist or oncologist at the earliest. Timely evaluation, accurate diagnosis, and personalized treatment can improve outcome and support better long-term health. We will be back soon on Pace Hospital podcast with another insightful episode. Until then, stay aware, stay proactive, and stay healthy. Thank you.